So just a little bit about my background. I'm actually an emergency doctor. So I work down at St. Paul's Hospital. I've been there for a long time. But I've really now moved into much more preventative medicine. And I guess really my journey has been, I've just been seeing people at the very end, right? Which still is the case for most of our acute care system. In general Western medicine, we wait for people to get sick, right? So the emergencies, as downstream as you possibly can go, we sometimes call it the final common pathway or the drain. Because when people get really sick or they don't know what to do at 2 a.m. on a Friday, where do they go? So illness, failures of the medical system, failures of the social system, they all end up in the ER. So the ER is a very interesting perspective to view certainly health in general, but even society. You see everything. And we have to try to figure out everything. So for me, at some point, I wanted to affect people's lives much more than just at the end. We can do heroic things. We can put stents in your brain to save you from a massive stroke, save you from a massive heart attack, but it's largely too late. That process has been going on for 10, 15, 20 years, right? So if we can intervene earlier, upstream, we can identify that and change the trajectory of that person's life. That person will not be in the ER at 2 a.m. on Saturday with a massive heart attack. So the reality, I'll tell you, I was there on Monday. We were looking after 65 acute patients in 20 stretchers, 45 patients in the waiting room. No stretchers, 2 nurses. It's like that every day. It does not make the news because it's just the new normal. There's no capacity. There's none. So we really have to shift the way we're thinking. We will still need acute care, but we have to shift to prevention. And exercise, this is a big piece here, is a very big piece of that. So, individually that's where it needs to go. Healthcare system-wise, that's where it needs to go. And so that's part of why I'm talking about this stuff. So, okay? So I'm going to talk about exercise and precision medicine. Has anyone heard that term, precision medicine, before? No, not really. It's kind of a new term, and I'll explain that a little bit. It's a little bit around saying things around personalized medicine. I love this quote. This was Edward Stanley, the Earl of Derby, in 1873. Those who think they have not time for bodily exercise will sooner or later have to find time for illness. Very true. Amen. I love this slide. I stole this from another slide. 24-hour fitness. Let's take the escalator. Right? So it's kind of how it's funny our society, right? Okay. Where does this precision medicine and exercise, where's the basis for this stuff? So this term epigenetics. How many people have heard this term epigenetics? Some people have heard of it. So epi means on top of your genetics, okay? What we've learned is your DNA or your genetics only tell part of your story. What really tells most of your story is how the DNA is translated, okay? So Jeffrey Bland's a very, very smart man. He's a biochemist who's founded the Institute of Functional Medicine, which is where I trained. And he basically says that our health and disease patterns, they're not hardwired by our genes, but rather a consequence of the interaction of your genetic uniqueness with the environmental factors. Okay, so 2 factors here. Genetic uniqueness, we are all genetically unique. And environment. And we'll talk about this part. So you, or what they call the phenotype, so that's the expression of who you are, is the interaction between the genes and the environment together. So that's the very important part about why exercise is part of this whole thing. The thing we're learning in biochemistry and medicine and everything is that if you really look at each individual's biochemistry, we're all unique. There's no single person on this planet who has the same biochemistry. Everyone has one or few analytes or factors that are different, okay? Which is why, as James was talking about the N of 1 studies, we've been doing these studies of N of thousands, of 10,000s, and we try to find averages, right? Which might be okay for a population average, but that may or may not speak to you individually, because you might not have the same biochemistry of all those 10,000 people, right? So this is the idea of precision medicine and personalized medicine. That's the way we're going to go. Right now, medicine is generally the medicine for the average statistical human being. None of us is the average statistical human being. We're all unique. So when they do studies, a doctor looks at the study and says, well, this drug seemed to work for 5% of that population, and it might work for you, but we're not really sure, and you might have a really bad drug reaction and die, or you might actually have benefit, but we don't know. And we haven't had a way to know. So we just say, well, looks like it might work, and let's try it. Okay, but that's going to change with this type of precision medicine. Precision medicine's really based on what we're calling the omics revolution. Okay, is that term omics? Has anyone heard about this term yet? So, omics is the last part of a lot of words. So, genomics, which is the study of genes. Metabolomics is the study of metabolites. Proteomics, study of proteins. Okay, so that's what they're calling the omics revolution. The other big piece, which is fueling this precision medicine revolution, is convergence of technology. So I did a presentation last year in Toronto, and I really looked at this stuff, and it's just unbelievable how fast things are changing. So I don't know if you guys know, you can sequence your DNA in a couple hours now. Like 10 years ago, it would have taken months. A few hours, your entire DNA sequence can be sequenced. And you know what? It's like less than $1,000 to sequence it now. And they think in the next 5 years, be down to a few $100s. Sequence your entire DNA. We can analyze hundreds of proteins and metabolites from a single drop of blood. Just a tiny drop. You know, you go to the blood test, your doctor gives you a lab requisition, you can check maybe 10, 15 parameters. We're talking about hundreds using something called mass spectrometry. You might be learning about stuff about the microbiome, so the ecology of gut bacteria is going to be the huge revolution in medicine. Again, now we're beginning to be able to see what bacteria, what species, what colonies are in your gut. Computing power, data storage, so all the information capabilities is exponentially rising. That's allowing us to understand all this data. Wearable technology, so sensors, and this is exploding, you know, so fitness sensors, everything's going to track our body, our movements, our physiology in ways we've never known, right? So right now, you go see your doctor once every several months, you do a blood pressure, it's one data point, right? The doctor's trying to make some decisions around that one data point, but what happened yesterday, or 2 hours ago, or what? So this is going to give us much richer data. What's been happening all day? What's been the averages? What changes? Where bodies are extremely dynamic. Internet, social media also is going to change a lot of things because we're sharing information, right? So people are just sharing their own data. So patients are actually learning much more about their own diseases than doctors are even learning. So yeah, so what they're calling this superconvergence, which is going to catalyze this transformation from the old medicine to the new medicine, is information systems, these new omic technologies, wireless sensors, mobile connectivity, internet, social networking, and computing power. There's a fantastic book called The Creative Destruction of Medicine by Eric Topol, he's a cardiologist. Fascinating book, and he's basically saying everything's going to change quickly. 10 years, it's going to change very quickly. Okay, just a little bit of this stuff, and then we'll kind of get more of the exercise thing. Just to explain a little bit about what we're beginning to understand. With the omics, we look at the DNA. Okay, so the DNA is like the blueprint, right? So blueprint for a house or a building. But just like a house or building, the blueprint in your actual house can be very different, right? Because it depends on the builder and the contractor and What if you have a shady concrete guy and you don't have the right electrical and plumbing? So your house could actually be quite different than the blueprint. So your blueprint has to be translated, okay? And that's translated into RNA. And these are like the instructions. And then they're made into proteins, right? So these are the actual structure and function of the body, okay? So has anyone done their 23andMe data? Yeah, a few people, right? So cool, right? Cool stuff. But it only tells you about this, right? And for many, many conditions, they're not single gene problems, right? So you have your one gene problem, sometimes it means you have a definite problem, but many things are not. So the genes only tell us part of the story. If we can look at what's translated into the proteins and what the proteins are making into these metabolites or biomolecules, we start to understand something completely different. Okay, so this is the new revolution, all right? So beyond genetics, but now measuring these other small molecules. Okay, so precision medicine, it's a huge movement in the US. It's just started in Canada. Obama started this. We'll see how long it'll last. But precision medicine is an emerging approach for disease treatment and prevention that takes into account individual variability in genes, environment, lifestyle for each person. Right? So again, that's where things are going to go. N of 1, your individual variability. Right? And this type of testing, omic testing, is going to allow us to understand one person's biochemistry like we never could before. It was never possible before, but that technology is allowing this to be possible. Okay, so a little bit about functional medicine. Who's heard of the term functional medicine? Some people have heard the term functional medicine. So functional medicine is looking at, this is probably this iceberg, looking at causes of problems, root causes of problems. The conventional system tends to look at the effects. Okay, so you've got high blood pressure, or you've got high cholesterol, you have something, or you've had a stroke or heart attack. And so they're focused on, signs and symptoms, diagnosis, and conventional treatment, okay? But I feel they don't look enough at what actually is underneath this iceberg, okay? It's like an iceberg, most of it's under the water. Okay? So functional medicine is about identifying and addressing upstream physiologic causes, trying to find these imbalances and correct them, and that way treat the disease and prevent disease. Okay, so not so much symptom management or disease management, but looking at underlying mechanisms. Okay, so that's where functional medicine I think is very, very powerful. This is kind of the roadmap or framework for functional medicine. I won't go through all of it, but it looks, again, instead of just naming a diagnosis, say someone has asthma or someone has stroke or calling a disease, we look at the 7 systems and look where the imbalances are. So how's your digestion, assimilation of molecules, defensive repair, how's your immune system working, energy systems, biotransformation, elimination, how does your body handle toxins, communication, that's your endocrine system, neurologic systems, transport systems, that's your heart and blood vessels, lymphatic systems, and structural integrity, all the way from cell membranes all the way to the bony skeletal form, right? So we focus on function, not just on disease states. We look very closely at what were predisposing factors or antecedents. What are the triggers that might have triggered a particular disease or illness, and what are mediators continuing to allow the disease to continue and not resolve? Going further down this tree, we look at these individual factors, looking closely at people's mental, emotional, spiritual influences, genetic predispositions, experiences, attitudes, and beliefs. And down here, sleep, relaxation, exercise and movement, nutrition, stress, relationships are down at the roots, right? So functional medicine, we address this type of framework. I was at a conference last year, and this was their kind of 4 pillared approach. So sleep, fitness, restore, and move. And So fitness, we'll talk a little bit. I've stole some of these slides from exercise physiologist researcher at UBC, Rob Bushell, so I've credited him here. So they're calling this stuff exercise omics. Okay, so using that technology we talked about, these molecules, and understanding exercise from that standpoint, okay? And how that could be powerful in terms of finding the appropriate dose for people and tracking and seeing, have we gotten to the right place by looking at this type of profiling. Molecular profiling, again, this is part of the UBC strategy. They're looking at many different diseases, but one of their big ones is exercise physiology, health and performance. They're looking at things like autism, diabetes, cancer, of course, different infections, cardiovascular things. So they're looking at a whole bunch of different things through this omic approach, okay? So again, I might be repeating some stuff James has been talking about, but the big question, there's no doubt that exercise is beneficial. No point talking about that, but really what is the right dose and delivery for a given individual? How do we track that? How do we look at that objectively and to translate that to health and performance, right? And so that's, really looking all the way from the genes to the small molecules, the cell, organ systems, and then all the way to the community, right? So now we're starting to be able to look at that entire continuum of how exercise can shift. Very interesting study called the Dallas Bed Rest Study. This is in 1968. These are just 5 different guys, like from university. These poor university students, right? They'll do anything for $20 or something. Some of them had, this was heart volume, right? So they were varying different levels of heart volume, and James, again, correct me if I get any interpretations wrong here, but what they did was they basically put them on bed rest for 21 days. 21 days. And everyone, including a guy who's quite healthy, everyone's heart volume decreased significantly in 21 days. And it took them like 40, 50, 60 days to recover where they were before. So 3 weeks of bed rest. These are healthy 20-year-olds. And it took them 60 days to recover function. So again, that kind of goes to show like how sensitive the environment is and how detrimental bed rest is, right? Or if you get sick. Now, interestingly, I found last night, they did a 30-year follow-up of this Dallas Bed Rest study. And these guys are all in their 50s right now. And they found essentially that 3 weeks of bed rest, and they say men at 20 years of age, had more profound effect than 3 decades of aging. So meaning, in their 50s, they redid all their physiologic parameters, and some of them were just playing golf, others were running regularly, all that stuff, but their heart capacity was nowhere close to what happened after 3 weeks of bed rest when they were 20. So, interesting. I'll send you the paper, James. You probably want to read it, but
see the drool right now,
right? So I'll send that to you afterwards. But again, so the whole thing about aging, if you remain active, you don't necessarily have to lose as much capacity, right? And these guys, they maintain their capacity even after 30 years. The numbers are quite impressive, actually. Okay, I saw you talking about these guys. Yeah, it's an amazing paper. I didn't read through all of it, but evidence for prescribing exercise in chronic disease. But the last paragraph clearly says, look, there's not even a question. It needs to be prescribed as medicine, and we just have to figure out how to do it, right? And they said for many conditions, exercise is as good as medications, and definitely in some circumstances, it's better than many medications. So it has to be considered first-line therapy for many conditions. I won't go through that. Again, a good slide I stole from Rob Bushell from UBC. Now, why is that? I won't go into this, but the science around this stuff is incredible and exploding. There's incredible brain effects. You might have heard about BDNF factors, heart stuff. reducing inflammation, affecting muscle, insulin, glucose regulation, mitochondrial function, everything. The more we look, the more we see how exercise is absolutely beneficial for every system in the body. And as we look at these small molecules, it's more the case. So, yeah, fascinating stuff. Okay, so a little bit about what they're looking with exercise omics. And again, I remember, back in med school about 20 years ago, the muscle was just a pulley. It was just like, it was a good biomechanical pulley, But it's way more than that. It's an organ. It's a secretory organ. It releases so many factors, molecules, and hormones. They're talking with the whole body. So when you exercise and your muscles are being used, it's releasing things that are going to fat cells. It's going to your liver to help determine how you break down sugars and fats. It's going into your blood vessels and the endothelium. It's going to your bone, everywhere. So the muscles are an organ. They're an organ as complicated as any other organ. And they're releasing all these factors, right? So that's why when you exercise, you're getting all of this stuff into play, right? Skeletal muscle, again, same thing. They're secreting proteins from the muscle itself that counteract the harmful effects of inflammation and pro-inflammatory. The different kinds from, this is like adipose tissue, fatty tissue, so they can release a lot of inflammatory molecules. So these myokines, or molecules from the muscle, are actually counteracting it. Right? So the muscle itself is creating things that are anti-inflammatory directly. And that, yes, again, affecting diabetes, heart disease, cancer, osteoporosis. Again, another complicated slide. I won't go through it, but the anti-inflammatory effects all the way from brain, muscle, adipose tissue, lymphoid organs, everything. And they're starting to understand this much more deeply. There's no better anti-inflammatory, right? So, when people come to the clinic and they're like, what supplements should I take, right? It's like they want to, and they're really picky, like, are you sure this is going to work? And what's the best anti-inflammatory? But they're not doing any exercise. It doesn't matter. Again, it goes back to the basics. If you're not eating well, you're not doing exercise, and you're not relieving stress, you're going to spend $200 in supplements, and you might as well just flush it down the toilet. Right? So, yeah, there's just no shortcut to this. This picture from Rob Rochelle's thing. This is the poor guy who's got intravenous catheters and taking pieces of muscle. So this is in the lab, But they're again finding, with exercise, 560 proteins are phosphorylated. So it just means proteins are changing just within one exercise session. Within one exercise session, the muscle's releasing things, changing DNA expression, even with one section of exercise. We're finding this stuff with other stuff, even with mind-body practices, so with meditation and yoga. They've done studies using some of the same technology before and after a yoga class, and after 20 minutes of yoga or meditation, pathways involved with, again, sugar regulation, inflammation, mitochondrial function are already changing in 20 minutes. So again, what you do on a day-to-day basis changes how your body functions, right? So that's the environment interacting with your genes. Okay, now James talked a lot before, so I'm not going to get into this, and certainly not an expert on this, but the question always is, is more better, right? But everything's got this performance curve, right? So if you're not doing much exercise, you're going to get benefit doing some, and there's going to be some optimal level for a given person. But if you start pushing it too much, you're going to start going down this curve. And I see that a lot. I saw Ironman athlete who ended up with a double pneumonia and kidney infection, and I said, look, that's not normal. You're 25. you should not be getting double pneumonia and kidney infection. He goes, no, I'm fine, my training level's fine. It's like, I don't know, I think you're probably not at your optimal. You're starting to get sick, you're getting immune suppression, right? So there is an optimal level, okay? So we talked a little bit about this. The one thing which I saw was, again, it has to be individualized, right? So, do you know about this study? This one here? Yeah, so, again, high-intensity interval training is good. There's lots of good evidence for it, but you shouldn't go from sedentary straight to HIIT. So, you need to build up, right? So, anyway, they do say that there are potentially some harmful effects. It's causing excessive stress, excessive oxidative stress on your body. And if your body's not prepared to neutralize the oxidative species, reactive species, you're going to cause damage, right? So again, it's listen to your body. There's an optimal for you individually. This is a slide from the Institute of Functional Medicine. And this talks about the relative risk of all-cause mortality. Okay, so this from 1 to 0.6 means a reduction in risk. Okay, it's like 40% reduction in risk here. So people who did what they call moderate to vigorous leisure time activity of 1 hour per week, they got some benefit. But as you got, the maximum benefit was closer to 7 hours of moderate to vigorous activity per week. It does kind of flatten out a little bit here. And I don't know, James, whether you know what happens if you go beyond. It still probably gets some benefit, right?
Probably gets closer to that.
Yeah, so it probably just starts flattening out here. Okay, so again, you do get more benefit when you do get to this, kind of 5-6 hours, right? And this is all-cause mortality reduction. Everything. Cancer, strokes, whatever it is.
So when you look at that, you see 40% less demand on capacity that you're seeing at the ER now.
Exactly. Yeah, that's the hope. Integrated physiology, again, incredible things they're doing in the lab. So they're actually looking at heart function, they're looking at mitochondrial function. So the amount of the technology and science around exercise physiology is fascinating. I'm just going to mention a little bit because mitochondria is a big piece of the story. So mitochondria are the powerhouses in your cells. They look like they were probably bacteria before, and our cells actually ate them and decided it was a good deal, symbiotic relationship. It's got its own DNA. The mitochondria has its own DNA, so really fascinating. Very complicated, but I just love this picture, this electron transport chain. That's how we extract energy by combusting oxygen and sugars. And again, it's just fascinating to see that if you look at someone who's endurance trained versus sedentary, these are different markers of mitochondrial function. There's significant differences between someone who's a trained athlete versus sedentary at the level of the mitochondria, right? So again, profound effects on cellular energy creation in the cells. So metabolic signatures, and this is where I think things get a little bit more practical now. Remember I said with a single point of blood, you can start measuring these array of proteins. So that's what they're able to do now. And they're actually finding signatures of what happens when you do exercise. And they're finding signatures of people who are, say, elite athletes, and the people who are sedentary but, exercised a bit, and they're finding distinct patterns, right? So what that means is we can start doing blood tests where we can tell someone, you know what, this is where your pattern is, and it's quite far from where we would think optimal might be. And then we can track to see, are you moving closer to the pattern of optimal based on your biochemistry, right? So that's the hope. It's still very, very early on, but that's what they're looking at now. looking at metabolic signatures in your blood of exercise. This is a great paper as well. Where will the future of exercise biology take us? And what I read from this stuff was this whole thing of organ crosstalk. I talked about it in another thing, but all the organs are talking to each other, right? Communicating with all these molecules in very complicated ways. And as we understand each of these systems more and more with this omic technology, we're going to really understand what exercise is actually doing to the body, what the right dose might be, what's it affecting exactly. So that's what they're talking about, this deciphering the molecular basis of exercise adaptation. That's why they're talking about the future of exercise biology. Same thing, this is basically saying we want to try and really figure out the right dose here, but we really need to figure out how to deliver this properly, how to create a health system to actually promote that type of stuff, right? Yeah, and basically, as what we've been talking tonight, exercise is medicine, right? And it should be. And it should be first-line medicine, right? So what we do at the clinic is we use lifestyle medicine as first-line medicine. We do not use medications unless it's really needed, but we always try lifestyle first. So diet, exercise, stress reduction, sleep optimization, that's first-line therapy. They're building this new center, I think it's called the Gun Pavilion at UBC. Yeah, so they're kind of looking at all these questions that we've been talking about tonight. And UBC, there's a company called Molecular U based out of UBC that is starting to do this molecular profiling. So there's very few places that can be done, but they're starting here, and Connect Health is one of the clinics that are starting to do this. And I'll actually show you, if we have time, my profile actually. But now you can measure your DNA, you can measure 200 proteins, you can measure 200 metabolites, and your microbiome, feed it into a computer system, and start to look at the patterns. And the idea here is that you would repeat this every 6 months, and they're trying to work on a dry blood spot, so you could actually literally just get finger prick. So you would go into an exercise program or a lifestyle intervention program, then you would recheck your molecular profile and you see what shifts. I've seen a few patients do this profile now, and one person had lots of markers for diabetes, a few cancer markers, a few Alzheimer's markers. He started on an exercise, diet, lifestyle program, and he changed all his markers. And you could see it measurably. So that was really good objective data for the patient and for the doctor to say, wow, you've shifted things. And we can actually measure it. So yeah, so molecularu.com, if you want to go and look for more information there. Just a little plug for our clinic. So I've co-founded a clinic called Connect Health, and we base our medicine on an integrative and functional approach. Integrative in the sense that we look at the whole person, mind, body, and spirit. We have MDs trained in functional medicine. We've got naturopath. We've got TCM doctors. We did have an osteopath. Melissa left us. We've got mind-body therapists, chiropractor. So we're trying to integrate the whole thing. So again, if you're interested, please talk to me or look at the website there. Yeah, no, we should.
Where'd that come from?
Okay, I'm going to just show you, just because this is it, this is my profile. So I'm really, really excited about this new technology because we haven't been able to really understand what's going on in the person's body. So if you think about it, when we talk about a particular disease like high blood pressure, what is high blood pressure? It just means a measurement that you've had your blood pressure has been high, but what is it exactly? So it's not really a disease, it's actually a symptom. So we take blood pressure medications to lower the number, right? But what exactly are we doing? So if we start to understand these profiles better, we can understand what's caused the high blood pressure. And if we can understand what's caused it, and treat that underlying mechanism, not just lowering the number, then it's a different story, right? So most diseases are that same category. What is asthma? It's a description of people wheezing and short of breath, and right, it's a clinical syndrome, but what exactly is happening? We kind of know there's inflammation, all that stuff, but for a given person, what's led to that asthma, right? So I think our whole concept of how we define disease is going to change. It's going to be understood from a mechanism level, not just a description of the symptoms, right? That's going to change. So, so many tabs I have here. So yeah, so it looks at different profiles, and I'm happy to share my personal data here. But it's looking at proteins, metabolites, genomes, and microbiome. And you know, for me, the metabolic stuff, there's actually a few markers for pre-diabetes. Right? So when I do my normal blood tests from Life Labs, they're all normal, right? But I've got a few markers. This glucose measurement's a lot more sensitive, but there's a few markers of different proteins that we just never track that are actually high here, right? So the benefit of this type of testing is this is probably maybe 5-10 years ahead of potentially a pre-diabetic condition. So for me, this is highly motivating. So I'm like, okay, interesting. There's a few markers for diabetes here. You know, I probably need to do more exercise or change some of my diet, right? So again, that's the hope of preventative medicine is we can make proper adjustments, right? Because, you know, the same prescription of, okay, you need to exercise and eat more vegetables and sleep, okay, yeah, whatever. I mean, I know that. But what specifically do you need to do? What is my specific risk? So that changes everything. When you can sort of look at this and say, actually, you know what? There's a few things here that need to be changed. Then make some specific changes and then recheck this, right? So that's the power of behavioral change. I'll just show you how people are starting to understand the data. So now they're mapping data into networks, okay? So again, we've been thinking in medicine very simplistically, like one molecule, one problem. You know, you have some abnormal blood result means one problem, but it's not that simple. So it's more like this mapper networks, right? So for example, this one factor here, coagulation factor 12, is linked to a number of different conditions, right? So now we can start to link the networks. This apolipoprotein C2, which came back too, it's linked to a number of different conditions. It's flagged as yellow here because it's relating to diabetes. It's also related to some fatty deposits in skin. It's also potentially related to heart disease and potentially related to high-fat diet.
So the bigger the bubble,
the bigger the bubble, the higher the association. Yeah, that's what's supposed to be. So again, we've never been able to look at molecules this way in people before. So I really do think that this is going to be the future of medicine. We're going to be able to understand someone's individual body in ways we've never been able to understand. I think we're going to be able to detect imbalances in systems way before they manifest into clinical disease. And the hope is if we find these things and with actionable, specific interventions,